My kids are the most important part of my life. I want to do all I can to help them succeed. One of the best ways that I can help them succeed is by helping myself. If I am healthy, I can be there for my children when they need me. Let me share some things that I have recently learned about my health as a Latina. Did you know that Latinos are at greater risk for certain health problems? We also often have more difficult time finding health care. There are 3 areas that we need to learn more about to improve the health of our families and neighbors. First, we can learn how to eat healthy and stay active. Second, we need to understand the importance of visiting a doctor even when we are feeling healthy. And last, we can learn what we need to do to have healthy newborn babies. While more than half of Utahns are overweight or obese, it is an even bigger health concern for Latinos. Nearly 7 out of 10 of Utah Latinos are overweight or obese. Being overweight or obese makes it more likely that you will have diabetes, heart disease, or a stroke. All of these serious problems can impact your ability to do the things that you want with family and friends. The good news is you can take action by making simple changes in your life. You can enjoy food, but eat less by avoiding oversized portions. Half of your plate should be fruits and vegetables. Another good way to maintain a healthy weight is to make at least half of your grains whole grains. Switching to fat-free or 1% milk is also an easy way to keep weight in a healthy range.
So some simple things I have done to change my super bad eating habits have been as simple as changing to a non-stick pan, which helps me cook with olive oil. Also, when I eat fast food, I try to order more grilled instead of deep fried or hamburgers. Overall, I feel more energy, I feel happier, and just full of life.
By using the information found in the nutritional label, you can learn which foods are better for you. Compare calories, saturated fat, and sodium or salt in foods like soup, bread, frozen meals, and choose the foods with lower numbers. Pay attention to how many people a package feeds by looking at the serving size. Drinking water instead of sugary drinks is healthier. A large soda contains 3/4 cups of sugar. Never go shopping in the supermarket when you are hungry. The healthiest foods are often found on the outer edge of a grocery store. Frozen vegetables and fruit are a great low-cost way to eat healthier. Physical activity is an important part of maintaining a healthy weight. Get at least 2.5 hours exercise each week, and children need even more time being active. Limit time spent in front of the television and video screens to less than 2 hours per day.
When we have family gatherings, I always make sure there's something active. Have you ever played sprinkler hot dog tag? I like to kick the soccer ball. I like to dance to music with the kids. Then there's throwing the ball to the dog and chasing the dog to get it back. When I move more, I feel more energized and less stressed.
These small changes can make a big difference in your life. Another important area where we need to educate ourselves is about the importance of scheduling regular doctor visits. You should have a family doctor and make appointments for regular checkups, even when you are feeling healthy. If you have a family doctor, you are more likely to receive screenings and immunizations than other people who do not have one. Visiting your doctor regularly can prevent illnesses and early death. Many forms of cancer are curable if found early through screening. High blood pressure, high blood sugar, and high cholesterol levels do not usually show symptoms and can only be found through screening. If caught early, these levels may be lowered with lifestyle changes and medication. If not, they can lead to diabetes, heart disease, or a stroke.
Preventative care is the key for a healthy lifestyle. In my experience, I was diagnosed with a diabetic condition last year, and this gave me a big wake-up call to live a healthier life. Now I exercise 1 hour a day and try to eat a more balanced diet. And I'm really glad that I went to the doctor.
Visiting a doctor is less expensive than visiting the emergency room. Emergency room departments don't know your medical history, and this can lead to very expensive and unnecessary tests and procedures. If you prefer to speak Spanish, you can ask for a medical interpreter. It is better to use a professional interpreter than a family member or friend. However, when necessary, you can bring an adult with you that you trust who speaks and understands English and Spanish. Never bring a child to interpret for you. It is important that you understand everything the doctor says and for the doctor to understand everything that you say. If you don't have health insurance, there are many state programs to help you get health insurance. Call 211 or visit www.211ut.org for referrals to health, food, and other services. You can also ask family and friends for referrals. There are also many Utah clinics that accept patients at discounted rates. Only call 911 for help during life-threatening emergencies, crimes, and fires.
For 2 days, I was just laying there and I could just feel the pain. I couldn't sleep on my side. Every time I turned, it was a problem. Like, I had just started work, so the health insurance wasn't there. So I didn't want to go to the doctor. And then my mother-in-law happens to work at the clinic, and she made an appointment for me. And, I came in, and they were professional, clean place. It's a lot more different than I expected. You gotta talk to family. You gotta talk to people that actually been here. She's been here for a few years, so she knew more or less. It's just, that's the only way to find a place. You know what I mean? To put yourself out there and actually ask questions instead of just sitting back and feeling the pain and never knowing if you're gonna get cured or not.
Healthcare is important for everyone. It is especially important for pregnant mothers. As Latinas, we need to make sure our babies have the best chance at success by making sure they are healthy from the very beginning. As a mother, it is important to think about your needs and your baby's needs. All women of childbearing age should take a multivitamin, not just those planning to have children. About 1 in 3 births are unplanned. You may not know you are pregnant. You should take a vitamin with 400 micrograms of folic acid every day. Folic acid is a natural vitamin that comes from foods like oranges, cereals, and leafy greens. Folic acid prevents birth defects such as spina bifida. Waiting to take folic acid after becoming pregnant is too late to prevent birth defects. Visit a doctor for a checkup before becoming pregnant. Women who are not at a healthy weight before getting pregnant have a higher risk of delivering too early and having other complications such as diabetes during pregnancy. It is very important to visit a doctor during the first 3 months of pregnancy. Make sure to attend all of the prenatal visits. It is important to involve your baby's father. Do not smoke or drink alcohol during pregnancy. For the first 6 months, the baby should only drink mother's milk. Continue to breastfeed the baby, along with introducing new foods until the baby is at least 1 year old. Breast milk is more nutritious for babies than formula. Breastfeeding helps protect babies from illnesses and sudden infant death syndrome. Breastfeeding also helps mothers return naturally to pre-pregnancy weight.
There are things that we can control and things that we can't control when it comes to outcomes with babies. One of the things that we can control is how long it takes between the last pregnancy and the new pregnancy. That is what we call the interbirth interval. We know from studies, actually some of them have been carried out here in Utah, that the optimum time in between pregnancies is about 18 to 59 months. We know from these studies that children can have problems when that interval is smaller than 18 months, especially less than 6 months. One of the problems is that the babies, for example, tend to be small for gestational age. That means that when they're born, they are of a lesser weight and they are smaller than what they should be. They tend to also be premature and they tend to be born before their due date. And this leads to complications because their lungs are not ready, or they're not ready to hold their temperature, they cannot eat as well. And so those are things that we can avoid by waiting more than 18 months between pregnancies. When it comes to the mother, it's also important to wait because we have found that mothers that wait less than 18 months between pregnancies have complications as well, or tend to have complications.
Take your child to all the well child visits your doctor recommends. If you notice changes or wonder about how your child is doing, always ask the doctor during your child visits. There are programs like WIC that offer assistance paying for healthy foods for pregnant and nursing women and for infants and children. WIC also provides information and support with breastfeeding. Mothers expecting a baby can find help at babyyourbaby.org or call 1-800-826-9662 or your local health department. If you need help to quit smoking, call the Utah Tobacco Quit line at 1-800-QUIT-NOW. Simple changes can make life happier and healthier for me and for us.